Streaming now from Kron 4, the Bay Area's local news station.
Bay Area supervisors are calling on congressional leaders and the White House to make sure counties across the country receive their share of federal funding in the next stimulus package. Joining us now is Contra Costa County Supervisor John Joya. Thanks for joining us today, Supervisor Joya. The National Association of Counties says areas like Contra Costa County aren't receiving enough federal funding. How is that impacting the county's response to the pandemic?
Well, Sanas, thanks for having me. And for everybody out there, I know these are challenging times, and county government is really at the forefront and on the front lines in responding to this pandemic. Our health workers, our social service workers, our first responders are all really out there protecting the public. And we I think it's important to note that we serve everybody, whether you live in a city or in an unincorporated area. We provide exactly the same health and social services and emergency medical services. So it is really important for us at county government to get our fair share, a fair allocation of federal dollars, because if we can't afford to cover this cost on our own, otherwise that bill is paid by our local property taxpayers. So we are very happy that we've had a great working relationship with leaders in Congress. We especially want to thank Speaker Pelosi and Leader Schumer for really working with counties to hear our concerns and needs, and also to Leader McConnell as well for his efforts in understanding the important role that county governments play in really fighting this pandemic.
Now, we hear about various counties and municipalities and everything receiving money, and it's all great when we hear it. But for the average, person, we may not necessarily how that money is allocated once it gets into your hands. Can you explain to our viewers where that money goes, how it's, spread up, and how you determine how much goes to what department, I guess?
Well, and again, we want to thank Congress for having allocated about $150 billion to local government. I think we appreciate that. That's important. We need more dollars. Just to give you an example, in Contra Costa County, we are spending from the beginning of March to the end of June about $100 million to respond to this virus, addressing increased costs, extra costs for all of our county staff who are specifically working to trace the virus. We have our own public health department and community clinic and hospital that is incurring a lot of funds. And that's in addition to the lost revenue we're going to be seeing as a result of all of this. So that's just our example. So multiply that out across this country, and you get a sense for how much we're spending at county government in responding to this.
And we don't know how long this coronavirus situation is obviously going to be around. March to June, what is that? That's about 3 months, and it's about $100 million. Of the 100,
it's going to go past that. It's going to go past that. We know that. We know that this is going to go beyond the impacts of coronavirus will be with us for some time, because, as you know, there's also a lot of economic and financial hardship that people are going through, and our own social service departments are already seeing an increased caseload and are going to be dealing with this for many months.
Now, do we, and this might be ignorance on my part, does the county have to pay for testing kits, I guess, or does that kind of just get granted to the county pro bono?
Well, we pay for some testing. There's testing going on in our own public health lab, and there's testing going on in health systems and in the private labs. The good news is the federal government has really talked about picking up the cost for testing. That's not a major cost, frankly. The major costs are things like we're spending money to set up a 250-bed medical facility in the old Ford building, which is an old Ford auto plant, to be able to handle patients if our local hospitals get overloaded, and that would be staffed by our own physicians and nurses at the county. So that's an example of of a large expenditure of county government attempting to prepare for a surge. So there's also cost associated with setting up these facilities. There's cost associated with actually providing the care. There's cost associated to our ambulance and first responders and to the social workers who are seeing increased caseloads.
Right, and I mean, it's a type of caseload that many counties probably have not seen. Has your county seen anything like this before in terms of just kind of this much work being demanded of county employees?
You know, I've been with the county for 21 years, and I know the history well before that. It's fair to say that in our lifetime, we have seen nothing of this scale. While we've had wildfires and earthquakes and local floods, this is significantly more than that because it affects everybody at the same time. This is not a crisis that is only affecting part of our population. It's affecting every one of our county residents. It's affecting obviously everyone around the world. So when we have a crisis like that, while we can prepare as best as we can, there's clearly going to be greater demands on all of what we're doing that we couldn't always anticipate. And let me say, the public servants at our county, we have 8,000 of them, have really stood up to work long and hard hours to really be on the front lines, put their own lives and families at risk to be able to provide those services. So all we're asking is a strengthened relationship and partnership with federal, state, and local government so that we can have all the resources we need to adequately address this, protect the public, save as many lives as we can. In fact, here in the Bay Area, our shelter-at-home orders, which were put in place, we were the first part of the United States to put these shelter-at-home place orders into effect. And it's making a difference. There's a lot more we still need to do, but we're going to be covering the cost and addressing this for many months.
And a big thank you to not only all frontline workers, but also those that you mentioned within your county who are basically putting themselves essentially in the line of danger to help save the lives of others. And you saying that, you know, in the number of years that you've been with the county and the history of the county that you know, this being the worst situation that the county has had to encounter, should shed some light for some people to really show the gravity of this situation and the need for the extra funding.
Yeah, and really the funding needs to be sustainable and ongoing. You know, county government is the social safety net, and the public relies on us on exactly moments like this. It relies on us when we are in a crisis, whether it was the recession over 10 years ago and we were processing more needs for health and social services to a pandemic like this. That's our job, and we're prepared to deal with it, but we do need to ensure that of something of this scope, the federal government is really helping local government, and we appreciate they've already stepped forward to do that. We're just saying we need more because this is going on longer, and frankly, we don't want to have to be in a position after this to have to cut services or have local taxpayers pay more to cover the cost. And we're optimistic with all of these, with the resources we're able to get. We're able to, as I say, keep our hospitals from getting overloaded and really have the minimum number of lives lost. I just want to also really acknowledge the personal stories that we're hearing from our own employees in health and social services who are saying, look, we understand it's our role. We're emergency service workers. And as I say, they go out to people who live in the cities, unincorporated areas, and we work well with our local city partners who are also relying on us to help them. They're relying on us to provide the services for those city residents that are being impacted. And we hope, for example, that the money we spent to set up this federal medical center and a building in Richmond, we hope that center never gets used. We hope the hospitals will not get overwhelmed so that we don't have to provide care in that facility. And the good news is we're beginning to see, as the governor said, with his leadership, strong leadership, a bending of the curve, but we still need to stay with this for the next couple of weeks. Our health orders in the Bay Area are in effect through May 3rd, and we'll be taking a look at what to do beyond May 3rd, and that'll be based upon looking at our hospitalization numbers and the use of ICU beds. At our own county hospital, in fact, there's 1,000 county hospitals around this country, all on the front lines. We have one of those here in Contra Costa. And we are seeing hospitalization rates here staying flat, which is a good thing, which means that our shelter at home is beginning to work. But we need to stick with it, and we need to all protect each other.
Absolutely. Now, you'd mentioned $150 billion that's going to be going to local governments, and there are over 3,000 counties across the entire country. Correct me if I'm wrong, but I'm assuming the number is not divided evenly between the counties. I'd assume that the federal government would be looking to see where it's hitting harder. Is there any sort of reporting that the county has to do to the state, in which the state then tells the federal government, or how is that whole process kind of handled?
Yeah, and we keep track of all of our activities, all of our expenditures. In fact, on any of our claiming with the federal government, we document what we're doing. In fact, we're getting public reports of that at our own boards of supervisors meetings by our county administrator, so the public is aware as well what this is costing and what everybody is doing. So yes, we document and we send this to the federal government. And again, think about the fact, even in a large place like Los Angeles, the largest county in the state, there are 58 counties in California, ranging from 1,500 people to 10 million people. Ours is 1 million. All of these counties, including Los Angeles, are doing ground zero and doing the work. In LA County, they're serving the people of Los Angeles and all the cities. And in our county, I'm working with in my own district with cities like Richmond, who also look to us for help. So we want to ensure that we have the resources to be able to meet those needs.
How much has Contra Costa County received in this funding?
Well, we right now haven't received dollars into our treasury, and the exact number is still yet to be determined. We're at this point, we'll be doing our claiming through the CARES Act to get the funding that we are eligible for. So we don't know yet how much we get or will get. That's why we're spending $100 million out of our own county reserves, because we need to spend this money, and that's what counties across this country are doing. They are fronting the money without necessarily knowing how much they're going to get back from the federal government, because that's the right thing to do to protect lives and to really mitigate the spread of this virus as much as possible. So we're all advancing our funding, not knowing exactly how much we're going to get, which is why we've all, as counties, worked together to be able to discuss with leadership in Congress and at the administration level about our needs.
And it's comforting to know that, county and city officials are doing what they can, spending the money, regardless of how much money that would be given back to the county or the city from the federal government. It's comforting to know that, that you have your officials kind of backing you up as a human being within the county.
That's our job, and that's why we're doing this. And this money, and what I'm not even referring to here is the lost revenue that we are going to see, and we're already beginning to see, as a result of the health crisis and the economic crisis, because it's both. This is a health and an economic crisis. And ultimately, we are concerned about being able to maintain core level of services even past this emergency. The important work that we provide in our county, we're running county jail, the 911 system, children's services, senior services, homeless services, libraries, health system, social services, including food stamps. So we're running essentially the safety net. And we are concerned about our ability to continue to fund those vital services beyond this emergency. And that's why it is important to have an ongoing supply of funding that is flexible. We've asked also for direct allocation to counties that doesn't necessarily go through the state, because we know best at the local level how to spend the money most effectively, where it has the greatest impact, and saves the most lives and is most efficient. So, county government's used to doing that. In fact, we are mandated by the state to run many health and social service programs, and the state provides us with funding, usually not enough, to be able to run those programs. So we have experience at the ground level knowing where the money is best spent and can make the greatest difference, and we're asking for that to continue, and with this extra funding, so that we can really help taxpayers and how that money is spent.
Now, Supervisor Joya, before I let you go, my last question is, your constituents, the residents of Contra Costa County, is there anything that they can do to kind of help push this effort forward? Could they contact, people in the government, or is there anything that your residents can do to kind of help with this?
It's always great to have residents contact their member of Congress and talk to their friends in other districts, to talk to their member, both talking to state legislators as well as our federal members of Congress, because when they hear from residents, I know they are all very responsive. We have a great legislative delegation here in the Bay Area, and great legislators across the state. And when they hear from the public, it's helpful. So we all can make a difference, just like everyone's making a difference slowing the spread of this virus by staying home and then masking their face when they go out. They can also make a difference at the federal and state level to make sure that we have the resources needed to be effective and to get us through this, because we're all in this together, and we all need to keep working together. And that means also in our own communities and with the federal and state government.
Well, Supervisor Joya, thank you for everything that you're doing. Thank you for, everything that your frontline workers in your county and just everywhere across the Bay Area and the country are doing. We really appreciate your time today, and hopefully you'll be able to, receive the money or the funding that your county needs during this pandemic. Thanks so much for joining us.
Thank you, and thanks for a great job.